Okay. Morning itself I told you disc lesion. One thing I told you clearly, initially during any disc compression or disc lesion, what will be the compression in the spinal cord? I told you, initially there will be hyperflex, fasciculation, and one particular thing. Yeah. Hypotone, yes. Yes. Hypotone, hyperflex, weakness, fasciculations. Okay. One more thing. Diminished tone and reflex. Okay. But later on, after some 3 to 6 months, when it is going for chronic stage, the same patient will be expressing hyperreflexia plus balance case also will be positive. But there, initially, acute stage, the deep tendon reflexes will be absent. The deep tendon reflexes will be absent, right? Okay. So that is this scenario happening here. And I asked the question, why? You remember? Okay. The same thing. Now is the time to remember that. So imagine this. Okay, imagine this. When it is happening, or else, sir, I'm not understanding this. Imagine the Valerian degeneration. Initially, the cord is getting compressed. Okay, slowly it lacks nutrition, it lacks everything, necrosis or whatever may be. So slowly the nerve cells are going for destruction. So ultimately that will be causing Valerian degeneration. Not only for single fiber, but all the fibers which are getting compressed. Okay, they will go for Valerian degeneration. So after getting degenerated, what will happen? This same scenario that is going to happen, right? And after a prolonged period of time, due to Valerian degeneration, of course, it will be affecting the corticospinal tract also or not? Corticospinal tract also affected or not? Affected or not? Compressed. The degeneration will happen in the corticospinal tract also, right? So that is what will happen in chronic stage. Slowly the degeneration will happen and move towards the corticospinal tract also. At that time, the muscles will go for spasticity and hyperreflex because of upper motor neuron lesion signs. But initially it is not like that. But anyway, whatever may be, whether it is injured or not, initially due to compression or injury, initially the spinal cord will be having edema. Lots and lots of fluid will be there. At that time, whenever you check any kind of patient, they will be showing very, very diminished signs only. Okay, later on only it will be developed, where it may be intervertebral disc prolapse or whatever may be the reason for the compression. So that will produce initially diminished, and later on because of VMN signs, it will be hyperreflex. And Babinski sign also will be positive. Okay, fine. Now the difference between the prolapse and the hernia. Hernia means sudden, or of course, I already told you it is interexchangeable. Prolapse means generally we say degeneration process. Slowly it is crossing, it is coming out of the socket, coming out of the annulus fibrosis, the nucleus pulposus is coming out of the annulus fibrosis and it is going to expel outside. And it's getting dried off. And those dried part will be compressing the spinal cord. Right? Initially, it will be producing inflammation. Okay? Inflammation. Where, sir? So this is spinal cord, right? When I'm trying to protrude like this is the spinal cord, this is the cavity for spinal cord. The spinal cord will be having a covering. What is that? This is the segment of the spinal cord. The spinal cord will be covered by what? The spinal cord will be covered by meninges. Right. Meninges. Right? 3 layers of meninges. What is that? Yes. Durameter, pyometer, letters. That will be covering this spinal cord. Right? Suppose our back leg, due to this intervertebral disc prolapse or infections or tumor or CSF inflammation, secondary reason, CSF inflammation, or any bloodborne diseases that may be producing inflammation and which is spreading across the entire central nervous system. Whatever may be the reason, whether it is pyogenic, viral or bacteria infection, or else direct trauma, or else the previous trauma which is settled down inside, or due to any ontogenic disorders, whatever may be the reason, there is a possibility of irritating the membrane.